Good evening, everyone, and welcome to the 2018 Action Plan Consolidated Public Hearing. This is a joint hearing of the Housing, Economic Development, Finance, Health and Human Services, Neighborhoods, and Small and Minority Business Development Committees. The purpose of this hearing is to review the proposed 2018 Annual Action Plan, which details the proposed expenditures of federal block grant funding. Those grants include the Community Development Block Grant, or CDBG, the Home Investment Partnerships Program, or HOME, the Emergency Solutions Grant, and the Housing Opportunities for Persons with AIDS Grant. The programming supported by these expenditures includes housing support, incentivizing and supporting small business development and community health initiatives, and therefore I am pleased to be joined by my colleagues that chair committees dedicated to those initiatives. I would like to thank Councilmember Hardin and President Pro Tem Tyson for joining the hearing today. Before we begin, I'd like to ask if any of my colleagues have any initial comments. President Pro Tem Tyson.
Thank you, Chairwoman Page. I'm excited to be at this hearing this evening because it will prioritize how our community members, the needs of our community members, the community development block grants, the home investment partnerships, the emergency solutions grant, and housing opportunities for persons with AIDS, and improves overall the quality of life for our residents. This is a strategy to improve the economic conditions for residents in our community. This plan focuses on enhancing affordable housing, services for special needs populations, housing options for the elderly, equal access to housing, and self-sufficiency for our low-income residents. This is just a few of the areas that are highlighted in this plan. I'm looking forward to hearing from our presenters and learning more details of the consolidated plan.
Thank you, President Pro Tem Tyson. And we will now begin with a presentation by Finance and Management Deputy Director Dan Giangardella. Thank you.
Thank you. Chairperson Page, President Pro Tem Tyson, members of council, first of all, let me thank you for allowing Finance and Management to present an overview tonight of the 2018 Consolidated Plan. I'll give a general overview of the grants program and then briefly discuss the administrative oversight portion of the plan, which is more specific to the Finance and Management grant staff. The City of Columbus is an entitlement jurisdiction that receives federal funds from Housing and Urban Development, otherwise known as HUD, to support local community development and affordable housing activities. The plan is developed with input from residents, neighborhood organizations, other community representatives, in a collaborative effort which the community helps us to identify housing, homeless, and community development needs. As a condition of receiving these grant funds, the City of Columbus is required by HUD to submit a 5-year consolidated plan which outlines the city's housing and community development needs and priorities. In 2014, the city developed its current 2015 to 19 community plan. This 2018 action plan for this evening describes the activities and programs for the 4th year. We're in the 4th year of that 5-year plan. And addresses the use of funds in really 4 key areas: affordable housing, housing for special needs populations, community and economic development, health, recreational, and social services. Those 4 areas essentially also consist of 4 key HUD grants: Community Development Block Grant, otherwise known as CDBG, the Home Investment Partnership Program, Emergency Shelter Grant, and the Housing Opportunities for Persons with AIDS, sometimes referred to as HOPWA. For these grant programs, for these 4 grant programs, the city must submit yearly applications to HUD. This process is known as the Action Plan. The 2018 proposed action plan outlines the city's use of these grant resources, the yearly budgets for each of these grant areas, as well as a description of the proposed programs and activities. The total plan being proposed for 2018 is approximately $12.5 million, which is about a 3.3% decrease from the previous year. Keep in mind, these are basically estimates at this time on what we may receive, as the federal government usually does not release the 2018 funds for some time yet. So these are estimates just based on historical data and information we have and best projections. The proposed 18 budget for these programs is essentially in 4 city departments: development, neighborhoods, recreation and parks, and health. And then, of course, finance and management as a 5th department monitors and reports activities associated with these grants and helps coordinate information to HUD. These grant programs, as I said, involve housing, economic development, social services, and the proposed plan for this year will list the respective funding levels as well as some narrative description of those grant areas. I will now address the general overview of the 4 budgeted areas, the 4 grant areas. For these grants, departments will provide some specific details and information on how they support these programs. First up, the Community Development Block Grant, which is the largest of the 4 grants, and the proposed amount for 2018 is just under $7.8 million, which is just slightly above our 17 level by about $21,000. Of this amount, about 75% of it, representing just under $6 million, goes to represent entitlement monies through HUD. The balance of those funds basically comes via revenue, income, and prior year carryover monies. These CDBG dollars are designed to support programs that assist low to moderate income residents and eliminate slum and blighting conditions within the city. The second grant program, the Home Investment Partnership, is budgeted at $3.1 million, which is about 13% less than in 17. Again, this decrease is a projection, mostly due to concerns we have over programs at the congressional level, funding at the congressional level, just that we anticipate potentially that Congress may reduce funds in this area, so we have a conservative estimate for that. These home grant funds are administered through the Department of Development and are used primarily to increase home ownership opportunities and the preservation and production of affordable rental housing for economically eligible communities. The third grant, or the third part of the plan, is the Emergency Solutions Grant, which is budgeted at $585,000, which is the same level as 2017. These grant funds, albeit smaller than the other 2, are used to coordinate and stabilize emergency shelter programs for people who need immediate housing, do not have the economic means to secure a place to live. The fourth and the last portion of this grant program is the Housing Opportunities for Persons with AIDS, again known as HOPWA. This budget is projected to be $950,000, which is similar to the amount available this past year. This grant is administered through the Columbus Public Health Department and is used to address the housing needs of low-income persons infected with HIV/AIDS and their families in the 8-county Columbus area. The process for applying and receiving these funds is a public one, and as part of receiving these grants each year, the consolidated plan is a process where we're required to seek public input. Part of that process is to allow the public and stakeholders an opportunity to share concerns or suggest future projects. We began this process with a 30-day notice on September 28, 2017. The public notice is to inform them of the proposed consolidated plan, the action plan budget, and the city participation plan, and of course, to receive any comments. This hearing this evening is part of that process, part of that public notification input process. Any comments that we get, we need to receive those by October 30th, which also coincides with the date that we anticipate Ordinance 2589 to be considered by Council for passage of the 2018 Action Plan budget. As far as we have some additional information, we have hard copies of the proposed plan actually here this evening, as well as the budget, and any individual can also gain access to this plan by calling the Finance and Management Office at 614-645-8069, or downloading it from the city's website at columbusfinance.gov or www.columbus.government/finance under the Grants Management section. Again, any comments can be sent to the City of Columbus, Department of Finance and Management, 90 West Broad Street, to the attention of Carolyn Thurman, who is one of our grant coordinators, or again, send an email to us, directly to Carolyn at cnthurman, so CNTHURMAN @columbus.gov. As referenced earlier, the proposed 2018 plan is $12.5 million, and it also involves supporting roughly 41 full-time and 79 part-time positions who help us to administer these programs in the various departments. The finance and management portion of this grant essentially involves the management, grant management for the CDBG funds. It is an amount of money of $564,000 and provides funding for 4 staff members as well as a loan management contract. The activities from the grant management staff we help develop. The plan, manage financial resources. They are there for regulatory compliance, HUD reporting, and monitoring. The grant staff also includes funding, as I said, of $90,000 for a loan servicing contract that helps with the city's housing and economic development loan portfolios. The grants management staff itself, as I said, involves 4 people. We've undergone a slight reorganization in 2017. We lost in the last 12 months 2 long-term employees, and we look to reorganize that staff, so we have actually 2 grant coordinators now and 2 other employees that help monitor and report information to HUD and work with our fiscal staffs in our departments to receive grant funds. I would like to thank our department directors also that are here this evening that will discuss these various programs in more specific detail. I'd also like to thank their fiscal staffs for working with the grant management program. And I would like to recognize Jarrell Potts and Teresa Nanter, who are 2 of our employees on the staff, but especially Carolyn Thurman and Amanda Perkowski, who are here this evening. They are our coordinators and have done a particularly good job in putting together this plan and the information that we'll be discussing tonight. That concludes my briefing, and I'd be happy to answer any questions you might have about the action plan or the grants management staff. Thank you.
Thank you, Director. Are there any questions or comments?
I think I'll wait till everyone.
Okay. We'll wait until the end. Our next presentation is Mr. Rory McGinnis, Deputy Director with the Department of Development.
Thank you, Chair Page and members of Council, for the opportunity to present the Department of Development portion of the 2018 Action Plan. Before I start, I want to thank Hannah Reed, Alex Cofield, Bill Webster, and Rita Parise for all their help on this presentation and for the implementation of our plan. The sum total of the 2018 CDBG home and ESG budgets for the Department of Development is nearly $8 million. The CDBG budget for 2018 is $4.2 million. The projected home budget for 2018 is $3.1 million and includes $450,000 in project program income. And the projected ESG budget is $585,000. The 2018 CDBG budget allows the Department of Development to focus its efforts on the core mission of the department and to address the priorities of the consolidated plan: economic development, housing, and neighborhoods. Some of the activities central to our mission are $777,000 for economic development. That includes $143,000 to fund the Neighborhood Design Center to provide support to businesses within the city's neighborhood commercial revitalization area. $100,000 to support neighborhood businesses in the NCR areas, and $500,000 for economic development loans and economic development contract management programs. It also includes $850,000 for code enforcement staffing, and then $2.6 million for housing includes $707,000, $155,000 for the following programs: home modification, vacant property prevention, rental rehabilitation, and emergency home repair; $260,000 for the chores and deaf services programs. Additional programs include $105,000 for the annual fair housing contract, $120,000 for the development of the fair housing assessment plan, $45,000 for the community development collaborative, $10,000 for the city's contribution to the Continuum of Care grant proposal, and $60,234 for the home buyer counseling. Home funds are used to increase home ownership opportunities and the preservation and production of affordable rental housing in the city. Our 2018 budget includes $2.3 million for the Affordable Housing Opportunity Program to build new and affordable housing projects in the city, as well as approximately 60 American Dream Down Payment Assistance Initiative loans. $134,000 for Community Housing Development Organization, also known as a CHODO, operating support, and $404,000 for CHODO set-aside projects. The Emergency Solutions Grant is provided to the Community Shelter Board for homeless to housing programs and shelter operations, and that's a portion of the overall dollars that the department proposed to fund the Community Shelter Board in our 2018 budget. For our accomplishments through September 30th of this year include for CDBG in housing, we have 473 households have received rehabilitation assistance in order to create affordable housing. In economic development, we visited more than 100 businesses through the business retention and expansion visits within NCR districts. We funded a total of 20 interior and exterior renovation grants, leveraging 5-to-1 private match for a total of $2 million investment in NCR districts. In code enforcement, the weed abatement program has mowed and cleaned solid waste from 432 properties in CDBG areas, and code enforcement has issued 116 work orders for graffiti removal. In land redevelopment, 1,800 blighted and abandoned properties were maintained. For home, 98 new units were constructed of affordable housing, and 147 rehabilitated affordable housing units have been completed so far this year. 39 down payment forgivable loans were made through the American Dream Down Payment Program, also known as ADDIE. And in ESG, 9,456 people were provided help through rapid rehousing and shelter assistance. For 2018, our proposed goals and objectives in CDBG for housing, through our Affordable Housing Opportunity Program, 700 households will receive rehabilitation assistance in order to create decent and affordable housing in the city. In economic development within our NCR districts, our goal is to assist 20 businesses through the interior and exterior renovation grant program to create or retain 35 jobs and assist 185 businesses. In code enforcement, our goal is to issue 130 work orders for graffiti removal in CDBG areas. And in home, we hope to complete 254 new construction affordable units, rehabilitate 147 affordable units, and rehabilitate 7 CHODO units for our 2018 rental program. 60 households will receive down payment assistance to provide decent affordable housing to first-time home buyers, and for ESG to provide rapid rehousing and/or shelter assistance to 9,000 members of our city. That concludes my presentation. Happy to take any questions.
Thank you, Director. Our next presentation is from Carla Williams-Scott, the Director of Department of Neighborhoods.
Good evening, Chair Page, President Pro Tem Tyson, and members of Council. I'm pleased to be here this evening to give you an overview of the Department of Neighborhoods and our proposed plan for CDBG funding for 2018. As we are the new kids on the block and the newest department, we don't have accomplishments for this year, but we look forward to coming back in 2018 to share with you accomplishments with the funding that we received this year. In 2016, the Department of Neighborhoods was created to deliver more comprehensive services to Columbus residents. The department combined the Neighborhood Liaison and Neighborhood Pride programs, formerly housed in the Department of Development. The 311 Customer Call Center, formerly housed in the Department of Public Service, and the Community Relations Commission. These were combined into one department, which now makes up the Department of Neighborhoods. In 2017, the department has 45 staff with a budget of $4.4 million. Staffing includes 39 full-time and 3 part-time positions. In 2018, CDBG funding will provide support for neighborhood and agency programs. 3 full-time employees with staffing cost at $317,000 and program services at just a little over $1.7 million. Funding will be used to support the neighborhood liaisons who respond to service requests and issues addressing housing, economic needs and opportunities for businesses, recreational youth programs, healthy food and healthcare access, zoning issues, and providing staff support for civic associations and area commissions. The neighborhood liaisons are a team of advocates that work across department lines to get results for our residents. They coordinate the exchange of information among neighborhood organizations and city staff. They provide technical assistance and serve as advocates on neighborhood issues, bringing together the investment of city resources in our neighborhoods. These liaisons are a vital connection between the city and our 19 area commissions and 200-plus civic associations and other community organizations. They work with residents throughout the city of Columbus on conflict resolution strategies and support and empower residents to positively impact their communities and build capacity for their neighborhoods. Through the 5 neighborhood pride centers and 6 neighborhood liaisons, we bring city services into our communities and provide a site for community members to meet and interact with city departments and divisions, such as code enforcement, Columbus Public Health, and the Columbus Division of Police Community Liaison Officers. Additionally, in 2018, CDBG funding will provide support for a neighborhood crisis response program. This funding will be used to rapidly address systemic neighborhood challenges in responses to spikes in violent crime through public facilities improvements and by addressing nuisance properties in our neighborhoods. CDBG funding allows local governments to build equitable neighborhoods and tackle serious issues facing our community. It is our goal at the Department of Neighborhoods to ensure that all of our residents have access to safe and sanitary housing, economic opportunities, and access to jobs. Thank you for the opportunity to share with you this evening, and I'm happy to answer any questions.
Thank you. Our next presentation is Mr. Steve Hyland, Fiscal Manager with the Department of Recreation and Parks.
Thank you for the opportunity to present the proposed 2018 CDBG budget for Recreation and Parks Department. The 2018 budget as submitted is $714,508. This represents a slight increase of $2,000 over last year's budget. This is made up of staffing cost of $672,000, supplies of $2,600, services $39,324, and refunds of $500 for a total budget request of $714,508. This also represents 4 full-time employees and the equivalent of 79 part-time employees. The first area that this funding serves is our Capital Kids After School program. It's $356,000. This provides funding for 4 full-time employees. They are located at Feddersen, Marion Franklin, Sullivan, and Beatty Recreation Centers. Each site serves 30 to 35 children in grades kindergarten to 5th grade. They provide academic assistance, recreation activities, socialization skills, family involvement, and they provide nutritious meals and snacks to the children. This program also operates a full-day camp during the spring break and an 8-week summer camp program. The second area funded is our Schools Out program. This is $118,000. This represents part-time staff costs, supplies, and services. The locations for these areas are Feddersen, Thompson, Howard, and Blackburn. We offer a 9-week summer camp. It's offered to income-eligible participants aged 6 to 14, and it serves approximately 300 children. Part of this program, we take them on field trips, things to the zoo, swimming, recreation activities. This is approximately 19 part-time staff. And finally, we have part-time staffing at the 9 centers listed: Barnett, Beatty, Blackburn, Dodge, Driving Park, Far East, Howard, Linden, Marion, Franklin, and Thompson. This is all part-time staff cost, approximately 60 equivalent part-time. So far, 2017 figures, we've offered more than 1,000 classes and programs and provided opportunities for 12,000 children that's served by these programs. And these are all frontline staff that are providing these opportunities for these kids, and it's all the part-time funding available through the CDBG budget. These programs provide a wide range of opportunities to children and adults of Columbus within the CDBG eligible boundaries. We appreciate the support and look forward to the continuation of these programs in 2018. At this time, I just offer any questions if you have any.
Thank you, Mr. Hyland. And our final presentation this evening is Audrey Reagan, Dr. Audrey Reagan, the Sexual Health Promotion Director with Columbus Public Health.
Thank you very much. Thank you, Chair Page, and all of the council members for this opportunity to speak with you about Columbus Public Health's efforts related to the Community Development Block Grant. As mentioned, I'm Audrey Reagan, and I direct sexual health promotion at Columbus Public Health. So my job is to reduce and maybe someday actually eliminate sexually transmitted infections. In 2018, the Community Development Block Grant will provide Columbus Public Health with approximately $180,000 to support STI and pregnancy prevention among youth. This is critically important, thank you, in our community, as nearly half of all the STIs that are reported in the United States occur between individuals between 15 and 24 years of age. Furthermore, here in Franklin County, approximately 60% of our chlamydia cases, again, occur in youth. They occur among people between 15 and 24 years of age. So it's very important to us that we're able to put some resources and some attention specifically on positive youth development. Columbus Public Health seeks to prevent sexually transmitted infections and unplanned pregnancies among these youth through education, screening, treatment, and referral services. So in the previous academic year, Columbus Public Health launched a new and very exciting partnership with Columbus City Schools to offer STI and pregnancy screening to students. These screenings are done in partnerships with parents, school nurses, Nationwide Children's Hospital, and Columbus Public Health staff. Last year, we were able to offer these services at Walnut Ridge, Briggs, Independence, Columbus Downtown, Beechcroft, and Global Academy. This year, we've added Mifflin, Fort Hays, and Columbus Alternative in the fall, and this spring we are looking forward to adding Eastmore Academy in the spring. To be successful requires that we let youth know about the importance of being sexually healthy. The Know Now campaign was launched to increase awareness among youth and the importance of having information and making healthy choices about sex and relationships. For pregnant and parenting teens, the CDBG grant allows us to provide case management services. In 2017, we offered services to 50 women, and this included regular home visits, education on pregnancy, women's health, infant health, and child development, housing assistance, and linkage to other support services. And I should mention that beyond the schools, pregnancy support services and pregnancy tests are offered at community-based locations as well, such as Huckleberry House, Columbus State Community College, Focus Learning Academy, Franklin County Jobs and Services, and other places. In addition, Columbus Public Health administers the HOPWA program, Housing Opportunities for People Who Living with HIV. And the purpose of this program is to provide stable housing so that people living with HIV can focus on seeking the medical care that they need. There's a national campaign going on right now called U equals U. And what it means is if you're undetectable, you're also untransmittable. So viral suppression for HIV is a key for HIV prevention. As already mentioned, our HOPWA grant is approximately $950,000 per year. We support 2 local agencies, Equitas Health and Lancaster Fairfield Community Action Agency, to help us with administering the program. And each year, we support approximately 100 households with tenant-based rental assistance or long-term supportive housing, approximately a number of 20 households with utility and mortgage assistance through the STRUMU portion, and case management related services to all of our clients so that we can help move them towards self-sufficiency. We're very grateful for the support that we get through CDBG and HOPWA, and I'm open to any questions.
Thank you, Dr. Regan. And that is our final presentation from staff. I would now like to open it up for questions from my colleagues. Councilmember Harden.
Thank you, Chair Page, and thank you to the directors for your presentation and your work each year in presenting to us the action plan. First, I think this is to Director Dan Giarella. I apologize, or Dan G, as I've taken to call him. I think good job in managing what we see as a $1 million decrease in funding from 2017 into 2018. My question is around, have we had outreach to our federal partners and delegations in terms of articulating what these decreases mean for our city, our overall budget, and our residents? Even in hearing that we have been able to absorb in a prudent manner.
Yes, Councilmember Harden, members of council. And first of all, we think these are projections. They're not official. Usually the feds are fairly slow at approving the final plan and dollars. So we are being conservative in our estimate. And you're correct. We're going to be likely down a few $100,000, but I think working with our departments, we'll be able to manage that. And probably here in the next few months, we'll see where Congress sits on the budget. As you know, they are entertaining a new tax plan and so forth. So like everyone, we're kind of anxiously awaiting what they're going to do, but we are taking kind of conservative estimate just given the things we've been hearing out of congressional activity in terms of these type of programs. We also know that these, CDBG, these type of programs do have wide support across the aisle of parties. So while there are those that would probably like to see some of these programs reduced significantly or even eliminated, we also know that across the country, including the state of Ohio, that there's still a widespread support for these programs. So we'll do what we have done in hard times, and we'll make it work. And our departments have been very creative about their programs, and we will continue to be able to serve our residents that are most in need.
President Pro Tem Tyson.
Just want to add some comments to Councilmember Harden's question. And certainly, that's why it's important that we also are a member of the National League of Cities, because they're located in Washington, D.C. And of course, we are a member. And I know that they work for us each and every day. And the CDBG has been on the chopping block for many, many years. And that it is important that all cities, including Columbus, which we've been doing, is providing our congressional members with what we do with these dollars and how important they are to our community. And I know our colleagues from across the country are also always sending the letters and lobbying about how important this happens to be. I know that even though we're doing that and we're saying we can make it through these anticipated costs, but when we get costs like 10% and 15%, reductions, and when you also add those to the reductions that we're taking at the state level, it does create challenges for us. And I'm glad that we are, saying we can kind of still provide these resources, but it really behooves us to continue to make sure that our state and local elected officials understand the result of these decisions on our community. And it means that these services that we've talked about this evening certainly can have a negative impact. And so, we just need to continue to be diligent in making sure that our other elected officials really understand the implications of the loss of these dollars.
Councilmember Elizabeth Brown.
Thank you, Chair Page. This is also to you, Director Gardella. You mentioned that we're conservative in how we budget due to uncertainty from the feds. How conservative were we last year, meaning relative to what we budgeted for? Did things work out kind of better or worse for us from what we predicted?
Yes, Council, I'll address this, and then I'll let one of my colleagues behind me, Carolyn Thurman, maybe look at some of this. But essentially, if I recall, I think we were concerned about cuts in CDBG in particular and some of the programs. I think when the federal government announced the programs, I think it ended up being better than we anticipated, as I recall. But I'll let Carolyn, if you could just maybe address some of the more specifics on that.
So with our projections for 2017, we actually received our dollar amounts from the federal government in June of this year, and we were very close to what we budgeted for. I think it was in CDBG, maybe a 3% difference between what we had budgeted for and what we received. Very close with home, very close on ESG as well. HOPWA, we actually received a significant increase of 13%. We're projecting a small decrease in HOPWA in 2018, just due to how the budget is created in Congress, and then expecting actually more money in that grant as well going forward.
Was the HOPWA increase, do you know, was the HOPWA increase due to their formula working out differently for us due to changing factors or demographics, or was it due to an actual increase from the feds of that funding?
It was actually due to a change in the formula that, not to get into the specifics of it, but it changed how it doled out money to different communities before it took into consideration historic levels of people living with HIV/AIDS, which isn't quite the same as the levels now in cities across the U.S. And due to that change in formula, we're getting a lot more money than we were in the past.
Okay, thank you so much.
You're welcome.
Councilmember Stenziano.
Thank you, Madam Chair. And a little bit open-ended, so whoever feels like they want to jump in and answer. This being the fourth of 5 years, what are opportunities for the community to engage and kind of hold us accountable to what the plans have been, where we've succeeded? I know we mentioned in the presentation, but opportunities not just at hearings, but out in the community if they have questions.
Councilmember Stenziano, members of council, you're right, this is the fourth year of our plan, and typically our outreach obviously involves these hearings annually before the budget is approved. We also typically have posted notices in Columbus Dispatch continuously for, I think, each of the last 3 years we did so. This year we tried a little different tactic, and that was to post in all of our recreation centers and also our Pride centers, and in the hopes that we would get and receive more input. We also, obviously online, we post the plan, and then I think we also did some social media via council's Twitter account this past year in order to just kind of get a bigger response. And we'd like to have more. We'd like to see more. We could definitely benefit by more input from our public. So we're open to any suggestions that might be out there to get the word out more on these programs. I think, was your second question about meeting goals? Okay, well, thank you. I hope I answered your question.
I have a question for Deputy Director McGinnis. As we were talking about housing, can you talk briefly about the scope of the problem that we need to address as a city related to housing, and how many affordable housing units we will be able to provide in 2018 using these resources?
Thank you very much, Councilmember Page, members of council. If you look at our presentation, you look at we have 700 units that our goal is to, let me just turn to my notes here. We have 700 through CDBG. We hope to serve 700 households for rehabilitation assistance for affordable housing in the city. And if you look at our results from the previous year in 2017, you can see that basically all of our achievements that we've done kind of relate to the different housing challenges that we have in the city.
Thank you so much. Are there any additional questions? I have one more directed at Recreation and Parks as well as the Department of Health. Could you talk briefly about how you select the neighborhoods that you're working in and doing some of your educational programming for health, and then as far as the, I believe, 10 recreation centers that were selected, why those neighborhoods?
Thank you very much for that question. And so how we select the neighborhoods, so for the teen STI, HIV testing and pregnancy, we look at the incidence rate by certain neighborhoods within Columbus City, and then targeted the high schools that are in those areas. And so that's how we selected those. For the HOPWA program, we really try to keep the folks in the community where they're already residing when we offer their assistance, just to add another layer of stability to their house. So in that case, we don't specifically target specific zip codes. It's more helping people where they are.
As far as the recreation centers go, it's the 9 that follow within the CDBG boundaries is the ones that we've chosen for the program. If that's the simplest way, I guess, to explain it.
Yes, thank you. Councilmember Harden.
Thank you, Councilmember Chair Page. This is actually a follow-up, I think, to Councilmember Stenziano's question about this being the 4th year of a 5-year plan. And just wondering, for those who weren't around for the planning of the 5-year plan, what are the steps, timeline for community folks to get engaged with as we go into the 5th year and planning for the next 5-year?
Councilmember Harden, members of council, obviously we're open to receiving input at any time. We obviously will have to put another plan together, and we will probably start working that beginning sometime next year, but it doesn't preclude us from receiving any information now or over the next 16 months for us to begin that process of putting that in place.
Thank you. We will now open our hearing up for public testimony, and we have 2 speakers this evening. If Mr. Kujinga Ashe could please come down to the podium. Welcome to council again, Reverend Ashe. You have 3 minutes, and thank you. And if you could also let us know any organizations that you are representing.
Giving honor to God, whether you call him Yahweh, Yahweh, Allah, the Most High, to all of you city council persons, city councilman Harden, Brown, Tyson, Page, Stenziano. I stand here. I am Minister Kujinga Elia Ashe. I live at 1119 East 16th Avenue, Columbus, Ohio 43211. I stand here with mixed emotions. Now, in the book of Isaiah, there's a question that's asked, who shall I send and who will go for us? And I represent probably 300 plus pastors in the concerned Linden clergy in the Linden area, also on the east side, the Interdenominational Ministerial Alliance, the Baptist Ministerial Alliance, and a lot of activists. There's a sign that says Linden, that's where I live. I'm one of the poor residents, who's out there suffering with everybody else. I don't get a paycheck from the federal government, nor from the state, nor from the county, nor from the city. I do everything that I have to do on my own, and from donations from people that I represent. Nobody that I know, and all of the 300 plus pastors that I know and talk with, has seen this report. None of them. I have back here Pastor Tatum, who's the chairperson of the Concerned Linden Clergy. Pastor Tatum, raise your hand so I can see you. And none of the people that we know has seen this. There hasn't been a distribution of it. Maybe you might say we've been slowful or backward or ignorant or whatever, but they don't know about this. Yet I represent these people. I've been home 4 or 5 years from imprisonment in Michigan on a false charge for 16 years. I've come back, I've got mixed all the way up into the top of the community. I'm on the mayor's committee for the east side, we Save the Neighborhood House Committee. We've pushed, and the mayor put together a commission to study that problem. I support council, I support the mayor. I've done everything I could with the shootings and the killings in the neighborhood, the housing. People are homeless, people are hungry. We go to the food pantries. We would like to see Linden look like the Short North. But how do we do that? McDonald's was closed down on Duxbury in Cleveland. We'd like to put a training facility there for returning citizens, ex-convicts, to train. I've got Mr. Larry Drugan back here as a construction guy, and I've got Pastor Noble Construction, Bishop Sims is construction, and they were willing to train the young people and the kids. They could do that in conjunction with Ohio State, Columbus, Community College, Franklin. We could do a heck of a thing right there on that corner if we had a building. We could do an arts program up by up north at one of the schools, one of the empty schools, where we could train the kids in the arts and crafts. But all of these things are needed, and we have a budget here that nobody has really looked at, and we're in the 5th year, coming into the 5th year, getting ready for the next 5 years, and we really need to give you a lot of input, a lot of things that we want. I know my time is up, but just if you'll indulge me for one more minute, I've asked Councilman Stenziano for best practices. We're starting a Linden Community Stakeholders Trust, and we want to buy up the properties in our communities. A lot of good houses are being torn down by the Blueprint, which the Blueprint is all right. But we don't want all these good houses torn down because people could live in these houses. We have, I've got to go and talk with the county treasurer, Cheryl Brooks Sullivan, our new elected. We have a meeting next week after I come back from Philadelphia to talk about how the county can be more involved. We've all got to work together. I love America. I've loved America when America didn't love me. And they locked me up on a false charge for all those years. I'm in the position now where I can do something to help. Like I said, I don't get a paycheck. I'm not looking for one, but at the same time, people need to be informed about all of these good things that council, all these good fine folks have done all these years, 4 years. They need to be informed, and there are 300 pastors that need a copy of this, and other community activists. Finally, in closing, on this weekend, I'll be in Philadelphia for the 20th anniversary of the Million Woman March. There'll be probably 2 to 4 million people there, 500 of us brothers, 500,000 or so of us brothers in support, a couple million women. And we will be meeting about housing issues and other kinds of issues in Philadelphia. You can see us on C-SPAN, CNN. You see the guy with the trumpet leading the parade, that's me. Basically,
Reverend O'Shea, if you could wrap up.
Yeah, that will be something that we can do. I'll bring back the information to the communities here. But the whole idea is that I love the plan, I'm in support of the plan, but I would like to see some shifting of some of the things in the plan, some shifting of priorities, something to meet more of the needs of the people that I serve and report back to. Basically, that's what I have to say, but I support the plan. I like the plan. I like what the new neighborhood department is doing and all of that, but at the same time, we need to have some more input and we need more transparency, and people need to get copies of this. So I thank you, John. Thank you, council members.
Thank you.
Any
And
questions that I can answer before I go? And thank you, Carl, for giving me a copy of this. I appreciate that. Any questions?
I don't think we have any questions. I would
Okay.
just like, and thank you so much,
Okay,
Reverend
thank you.
O'Shea. I would like to ask Deputy Director Jean Gardella to, again, talk briefly about the public comment process. I believe that that is still open, and how individuals can not only view the report, but also make any comments.
Yes, Councilmember Page, members of council, again, we post it in the rec centers, pride centers. It is available online. We used council's Twitter to send out information. The public comment period is still open, and we welcome Pastor O'Shea's comments and review of the plan. It is a 5-year plan. However, it can be amended. As the current iteration of it is looked over, moving forward, if there are things that the city can hear about, that we can seek input and that would be eligible, and I think there's always eligibility requirements for these programs, we'd be happy to listen and take any input that we can receive from the public with respect to this. Thank you.
Thank you. And our final speaker this evening is Mr. Larry Drugan. Welcome to council. If you could let us know any organizations that you're representing, and you have 3 minutes as well.
Chair Page?
Sorry, Councilmember Harden.
No, just quickly, I wanted the Director, Carla Williams Scott, to speak on the work that we're doing in Linden with the engagement in pastors, and I think that part of the CDBG in general goes to support good work that's happening there, and just want to make sure that Minister O'Shea knows about opportunities and folks that are watching for engagement, especially in Linden.
Thank you, Councilmember Harden. Yes, the Department of Neighborhoods is currently involved in a community planning process with the Neighborhood Design Center in Linden, and I know Minister O'Shea is involved in that as well. And through this community planning process, we are conducting a comprehensive needs assessment that will guide future growth in primary areas of health and wellness, retail and small business, housing, education and workforce, community safety, and transportation. And as I was sitting here listening to the conversation, we would certainly be open to working with our colleagues in finance to help with outreach in the neighborhoods and with the clergy as well.
Thank you, Councilmember Harden. Welcome, Mr. Drugan.
Excuse me for all of you seeing my best side here. My name's Larry Drugan. I have a company called DTV Real Estate. We're general contractors. And what you're doing with the development money is phenomenal. I've worked in the inner city redevelopment for over 40 years. I've worked with HUD block grants when it was handled under MORPC. And one of the things that we are doing, which Mr. O'Shea, Reverend O'Shea touched on, is we need to work with some of these people becoming homeowners, but also getting them into job training so they can afford the home. There are different programs we've utilized in the past with CMHA and FHA. What we will do is we can do FHA loans, and it's guaranteed by CMHA. They'll guarantee 10 years of a 15-year loan. Then the homeowner then has a same as rent, like a TTP, their tenant portion, and it gradually goes up as we get them into job training, help them earn more and more money. We're looking for development and stabilization of the neighborhoods, get a lot of the absentee landlords out, which also promotes a lot of the drug usage, because a lot of the drug dealers, they don't care. I've had people come in, ask me to come into their house and look at their plumbing. They have no plumbing. they shouldn't be allowed to be in the house. They have no water, they have no plumbing, it's unsanitary, yet they still rent the place to them. The people are still paying rent, and a lot of them, they're just dealing drugs out of them. So they don't care, they don't complain. So we need to handle a number of things in that regards. Like I said, a lot of it becomes as home ownership, not just rentals, and it needs to be truly through a lot of the grants that can help come back to these individuals and make it affordable housing. Because that is one thing, like I said, when I worked with CMHA, I can get a lot of people into houses for roughly $300 a month. And then if they get tax abatements on top of that, so they're not paying the escalated value on the house, essentially they're in for, like I said, between $300, $400, maybe $500 a month into a house payment, and that reduces the amount and it saves millions for CMHA. So this is basically what I would like to do, working with City Council and working with the other development areas, is help utilize or help direct into some of the areas. And like I said, with a women's shelter that I've worked with for quite a few years, is now Catholic Social Services, but at the beginning it was just the women's shelter. And we have to try to figure out where they were abused so we can move them to another area of town. And that's always been an issue, is to try and find out where we can kind of move these individuals so we can't buy a block of houses and then put them into them. So anyhow, like I said, to make it affordable, we need grant money in order to make it affordable. So that's all I have. I gave you back 9 seconds. So any questions?
Thank you so much, Mr.
Did I make
Dugan.
sense or did I ramble?
Made sense. Thank you so much
Thank
for coming down. President Pro Tem Tyson.
Thank you. Thank you for coming down, but I also just want to mention that if you're going to individuals' houses and they don't have plumbing and they're staying there, I would ask that you would please call 311 so that we can, because we don't want any of our residents being in property that don't have the proper plumbing. And so I didn't want to have you leave here without really addressing that issue when you see that happening, or because we want people to be able to be living in places that that provide them with the utilities that they need to be able to live there in the proper manner. So if you would please do that. But again, I also want to thank you for your work with CMHA. Look forward to having more discussions about more affordable housing. And certainly Councilmember Page is certainly focused on affordable housing, and anything that you've been doing with CMHA I think will be very helpful to us.
Okay, thank you very much.
Are there any concluding comments from any of my colleagues? President Pro Tem Tyson.
My comment, I'll let you in that, but I just have a quick announcement. I think that's important for the community, if I could give that, please. So on October the 28th, which is this Saturday, is National Prescription Drug Take Back Day, and which aims to provide safe, convenient, and responsible means for disposing of unwanted prescription drugs, and also educating the community about the potential for the abuse of those medications. And Columbus Public Health, again on October the 28th, from 10 to 2 will be, you can come and drop off any of your prescription drugs, because you do not want to put them in the trash. Instead, stop by one of this particular location to safely dispose of your unwanted prescription drugs. Thank you. Councilman Page.
Thank you, President Pro Tem Tyson. And this concludes the hearing on the 2018 Annual Action Plan. This is definitely a huge coordination, not only across the administration, but across council as well. I'd like to thank and acknowledge their co-sponsors, President Pro Tem Tyson and Councilmember Shannon Hardin and Elizabeth Brown. I'd also like to thank department staff, Matthew Erickson with LRO, and the members of the public in attendance today, as well as any viewers watching at home. Thank you so much and have a wonderful evening.